Hello, my name's Caroline. I'm one of the speech and language therapists working at South Tees NHS Trust. And this video today is a brief introduction into some of the work we do working with babies and children who have feeding difficulties. Now, some of you might not know that speech and language therapists work in this area of feeding difficulties. It's the same muscles and movements and brain control that we use for speech and talking as it is that we use for sucking and chewing and swallowing. So some of us speech and language therapists specialise in supporting children with the development of these skills. So we might pop up in places that you don't expect. We work in the neonatal unit at James Cook Hospital. These babies born early are still learning how to coordinate the skills of sucking and swallowing and breathing, the skills that come easy and inbuilt for babies who were born at term. We also see babies and children in their homes. So we might see babies who are coughing or choking and struggling with their feeds. We might see babies who get tired on their feeds and struggle to take in enough calories to grow. We see babies who have reflux and babies that are refusing to feed. We might see older babies or children who are struggling with weaning, might be struggling to move on to different textured foods. If you're at home today and you have a baby or a child and you are worried about their feeding, please do discuss your concerns with your health visitor, and it may be that a referral to our service might help. One of our main roles is to assess if babies and children or young people have a safe swallow. If we have an unsafe swallow, this is called dysphagia. And if we have an unsafe swallow, it means that we are at risk of literally food and drink going down the wrong way and getting into the lungs and the chest. This is called aspiration. If aspiration is left untreated, it can mean that we are at higher risk of chest infections, of poor weight gain and poor development, or more severe illnesses such as pneumonia. So if your baby or child is referred to our service for a dysphagia, for a swallow assessment, there's several things we're going to want to do. Firstly, we're going to want to get some more information about your child's wider development and their skills and their general health. We're going to want to ask you about what your concerns are and what your worries are with your child's feeding. We're then going to need to observe your baby or child feeding. So we'll always try and time our appointments around when your baby or child might be having something to eat or drink. Or if we invite you into a clinic appointment, we usually ask that you bring something for your child to eat and drink during the appointment. We're going to observe their oromotor movements. These are the movements of our face, our jaw, our cheeks, our lips and our tongue that we use when we're sucking or chewing and eating. We may then listen to your child's swallow using a stethoscope, which we'll place on the neck here so that we can hear their swallow. If we have enough concern, we may also then request an X-ray assessment of their swallow, which is called a video fluoroscopy, and that can help us to be really sure about the safety of that swallow. Many of the children that we work with in the dysphagia team will have other complex health needs. So for example, we might work with children with Down syndrome who can sometimes have problems due to their low muscle tone. We might work with children who have cerebral palsy, who can have difficulties with their overall movements, so again can have difficulties with their chewing and swallowing movements. We work with some babies who may have needed to have surgery when they've been very young and had a period of tube feeding, and so we need to assess their swallow to see if they're safe to go back to eating and drinking normally. Sometimes if a baby or child has needed a period of tube feeding, or they've needed ventilation, or they've needed some other medical interventions, it can make the face and mouth very sensitive. And this means that these babies and children can struggle to get back to eating and drinking as normal. This can then be really difficult for parents and carers to understand, as normally eating and drinking is easy and fun and enjoyable. So as therapists, we work with these families to find ways to support their children back to enjoying eating. Sometimes this can be an easy, quick journey, and sometimes this can be a very long and frustrating journey. So to illustrate this, here's some brief videos of a little hero that I know called Jacob and his journey back to eating.
done, Jacob. Clever boy. That was clever. What are they? Chips. Nice.
Changes your whole world. I look at myself every day in the mirror and see this person that I don't know. And that's hard.
Yeah. Thank you.
Oh, it's nice.
Oh, you've got. Joshua Jacob's eating scrambled eggs. Let go, get your fingers out. Watch Jacob. Are you watching? Watch Jacob eat this scrambled egg, Joshua. You watch. Oh my goodness. High fives. Oh, go on, swallow. Was that a bit big, that one? Try again. Chew it up. Chew it. Yum, 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 yum. Yum, 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 yum. Is it gone? High five, Jacob.